Good afternoon, everyone. Today is Thursday, March 3rd, 2022. We are the Senate Budget and Tax Committee Subcommittee on Health and Human Services. We have one budget before us this afternoon. That is the Maryland Department of Health Developmental Disabilities Administration. We have analyst Morgan Smith, who will start us off with her presentation. Good afternoon.
Thank you, Madam Chair. I'll be presenting the operating analysis for the Developmental Disabilities Administration today. And on page 1, you'll see the operating budget summary for DDA. In fiscal 2023, the budget increases $107.8 million, or 7.1%, to $1.63 billion. And of the increase from the 22 working appropriation to the 23 allowance, most of this increase occurs in the Community Services Program. There was $30.2 million allocated for the expansion of the waiver services and $57.4 million for the mandated 4% provider rate increase. The first supplemental budget of 2023 also added $85 million related to the 10% enhanced match on home and community-based services as authorized in the American Rescue Plan. Jumping to page 5, Exhibit 1 shows the individuals served by DDA across all DDA waivers. And of DDA's primary goals, one of them is to increase the number of eligible individuals receiving community-based services and enrolled in the home and community-based services waiver. Their goal in particular is to grow from the prior fiscal year the number of individuals enrolled by 0.3 percentage points. And in 2021, DDA had 97.7% of individuals receiving community services enrolled in DDA waivers, which is an increase from fiscal 2020, where they had 93.5% of individuals enrolled. On page 6, you'll see Exhibit 2, which highlights the DDA waiver slots by waiver. And just as a quick reminder, so the used category indicates that somebody has filled a slot. This count is maintained throughout the fiscal year and includes individuals who have since left the program. So if an individual within a fiscal year leaves the program, moves out of state, what have you, the slot is still considered used. The active slots indicate that there's a person living in Maryland in this fiscal year who is still in the slot. You'll notice that the Community Pathways slot has more slots than everywhere else, and that is because this waiver supports both children and adults in receiving both meaningful day support and residential services. DLS has asked MDH to comment on the efforts the department is taking to increase the utilization of these waiver slots. Current numbers show that some of the authorized slots are not being used. So MDH will comment on the unfilled slots and the impact of these slots on their ability to use the 10% enhanced match to expand waiver slots and provide updated cost estimates per waiver program. On page 7, Exhibit 3 shows the point-in-time community services waiting list counts. DDA tracks more than 3,700 individuals who meet the statutory requirement of having a developmental disability. They're broken into priority categories, with crisis resolution being the highest risk category. Individuals in this category typically are at risk of harm or homelessness. And the current request category is the lowest risk, with those individuals not having risk of harm or homelessness. You'll see that in recent fiscal years, the number of individuals on the waiting list has declined. And previously, DDA reported that the expansion of funding has allowed for new replacements from the crisis resolution and transitioning youth lists. Transitioning youth, in particular, are aging out of the educational system, foster care, or the Maryland State Department of Education autism waiver. They qualify for a reserved category on the waiting list to allow for their applications for DDA-funded services upon aging out. Between graduation and being enrolled in DDA services, qualifying transitioning youth are eligible for both meaningful day and employment services through the Governor's Transitioning Youth Initiative. But during the COVID-19 pandemic, some transitioning youth were unable to complete the DDA waiver enrollment process, which impacted their ability to utilize these meaningful day and employment services. through the state of emergency, transitioning youth who had trouble getting the application process, getting through the application process, and who would have otherwise aged out and been disenrolled from services, are still able to submit the DDA waiver application by June 22 to be considered for DDA funding. And this was provided in Appendix K, also known as the Emergency Preparedness and Response Appendix, and I'll talk about that later on in the presentation. DLS has asked MDH to comment on the current status of the wait list. On page 9, Exhibit 4 shows the waiting list equity fund balance over the last 5 fiscal years. Currently, statute dictates how this fund is used, and it prevents funds from being used for emergency placements or transitioning youth, and restricts the funds to the first year of an individual's placement in the community. The balance of the fund continues to grow due to the low spending because of these restrictions, and between fiscal 2020 and 2021, the fund grew by $1.1 million to $11.4 million. MDH has been asked to comment on any progress in considering options to adjust statute to expand the allowable uses of the fund to reduce the growing balance. Lower on page 9, I'm going to quickly go through the items from fiscal 22. So as you may already know, the Families First Coronavirus Response Act provided an enhanced federal match, also known as the FMAP, of 6.2 percentage points on qualifying expenses made during the nationally declared health emergency during the COVID-19 pandemic. This applies to eligible spending under DDA's 3 waiver programs beginning July 1, 2020, and the fiscal 22 budget as enacted had $37.5 million in general funds reduced in anticipation of the receipt of the FMAP for the first 2 quarters of the fiscal year. The fiscal 23 budget assumes $20 million of general fund savings in the form of a reversion for the 3rd quarter because the national public health emergency was extended, and subsequently the first supplemental budget of fiscal 23 included a proposed deficiency to acknowledge the 4th quarter of savings. So that was $21.5 million in general fund savings, which added an equivalent federal fund appropriation. To date, the associated federal funds for the first 3 quarters have not been added to the fiscal 22 budget for DDA, despite these additions having occurred in other areas of MDH. And DLS is asking MDH to comment on why the additional federal funds from the first 3 quarters have not been added to the budget. Page 10 talks about the home and community-based related FMAP. The American Rescue Plan increased the match for qualifying Medicaid home and community-based spending by 10 percentage points from April 1st, 2021 to March 31st, 2022. The value of this 10% enhanced match must be reinvested in the home and community-based services by March 31st, 2024. In fiscal 22, $85 million was added to the budget through an amendment for DDA reinvestments, and then the supplemental budget of 2023, the first one, provided $85 million in federal funds for the same purpose. It's important to note here that the language in the fiscal 22 budget bill required DDA to spend at least 75% of the federal funds attained from this match for a one-time Medicaid home and community-based services rate increase, which is paid to providers. The remaining 25% is utilized for grants to providers and administrative expenses. And as reported by MDH in the most recent spending plan, the total cost of the rate increase over multiple years is about $221 million, and they intend to use another $60 million on grants to providers and $24 million for administrative purposes. DLS has asked MDH to update the committees on the planned expenditures by fiscal year for rate increases and other enhancements. Exhibit 5 on page 11 shows the overview of agency spending. As I mentioned before, the fiscal 23 allowance totals $1.63 billion. 99% of DDA's budget is utilized for community services, while the other 1% is utilized for program direction. You'll see that of the 99%, residential services takes up nearly half, with $777 million being utilized for residential services. DDA estimates the average annual cost per residential services client is around $135,480 in fiscal '22, which is a decrease from the most recent actual in '21 of $135,971. For comparison, day programs, which is this green slice on the pie chart, serves more clients annually, but the average annual cost per individual is much lower at $18,670. Other operating expenses, this dark blue slice, that covers regional offices, which oversee the services provided in each region, with the funding allocated totaling about $28 million. The overview also includes a pie slice indicating the 10% FMAP for home and community-based services, as discussed earlier at $85 million. On page 12, you'll see the proposed budget changes for DDA. In fiscal 2023, the allowance increases by $107.8 million between the 22 working appropriation and the 23 allowance. And this is primarily due to proposed deficiency appropriations and the supplemental budget number 1 appropriations. As I said before, the majority of this increase is within community services, including the $20 million resulting from the targeted reversion in fiscal '22. DDA also saw $87.8 million to cover the expansion of waiver services, new placements, and the mandated 4% provider rate increase. On page 14, you'll see details on personnel. In fiscal 2023, DDA's regular positions decreased by 2.5. 2 of these positions were transferred to the Office of the Chief Medical Examiner, with 1 part-time position transferred to the Board of Nursing. The fiscal 23 allowance includes a net decline of 11.17 contractual full-time equivalent positions compared to the 22 working appropriation. This is primarily due to a realignment of positions between the community, residential, and day services programs to align more closely with actual FTE counts. And just a note about the vacancies in 2023, or as of December 31st, 2021, the percentage of vacancies was slightly high at 20.5. The majority of these positions, 14.5 of them, were within the community services regional offices, and most of those positions included service officers, secretaries, and other administrative positions. Jumping to page 15, Exhibit 7 highlights COVID-19 positives across the various DDA service regions. The Deputy Secretary of DDA provides monthly webinars with information on COVID-19 related updates, including vaccination and positivity rates periodically. On the October 29th, 2021 webinar, MDH cited 17,764 DDA members, with 2,362 of those being tested positive, and they cited 114 deaths. It's important to note here that these numbers are not updated to the Omicron variant phase. Exhibit 8 on page 16 shows the vaccination rates across DDA participants. DDA reported as of that October 29 webinar that 15,896 DDA participants had been vaccinated, and as of the January 28th webinar, the agency reported 4,301 participants had received their booster shot as well. While DLS was provided recent vaccination data, it was provided after the finalization of the analysis, so the analysis still includes bold language asking MDH to comment on the vaccination rates, plans to encourage the booster shot, and the impacts of the Omicron surge across the DDA service regions. Issue 2 is about the Community Services Utilization Data Collection and Spending Forecasts. Language in the fiscal '22 budget bill withheld $1 million of general funds for administrative funding in DDA, pending the submission of a report on the utilization data collection and spending forecast by November 1st, 2021. The report was received January 13th, 2022, and this report is important because DDA is moving from a prospective payment model to a fee-for-service reimbursement model, and this transition includes moving service authorization and billing functionalities from the Legacy Provider Consumer Information Systems 2, also known as PCIS 2, system to the state's existing Long-Term Services and Supports LTSS system. The LTSS is utilized by other Medicaid programs across the state. During this change, DDA will be implementing both new community services and provider rates. Exhibit 9 on page 18 highlights the number of individuals receiving DDA-funded services and providers billed through the LTSS system. You'll see that this is broken up between prior to fiscal 22 and fiscal 22, just to give you a sense of before and after. And the early adopter group pilot, which is the last one listed, which transitioned on July 1st and October 1st, transitioned all of their individuals to LTSS, whereas the first 3 groups chose individuals that they wanted to transition during this pilot program. In the report, MDH indicated that monthly reports on utilization by service type would be submitted to DLS on the 15th of the month, with data from the prior month included in the report. This timeline did not include a start date, and as of the writing of the analysis, DLS had not received an initial report. However, MDH did provide some initial data in the report that we're using here in Exhibit 10, and it highlighted claims details from July 1st, 2019 through October 31st, 2021. This is specifically for services billed through the LTSS system, and you'll see that targeted case management takes up the vast majority of the claims. This is primarily because these services transitioned first, or the earliest, with other services following closely behind. You'll notice that the other category only has 9,184 claims, and these are varying claims that made up less than 1% of all claims. To compare expenditures under the LTSS and PCIS2 systems, MDH provided DLS with some data between December 2019 to December 2020. And you'll see that pilot providers received roughly 62.2% more for claims based on the fee-for-service model in LTSS as compared to the PCIS2 model, which is what they were using previously. This 62% may not be reflective of actual costs of the new payment system when all providers and clients are enrolled. And for illustrative purposes, a 62% increase in provider payment would require an additional $850 million for annual expenditures by DDA, including $463.5 million just in state funds. The fiscal 23 allowance does not provide funds to begin implementation of such a transition, and the department should discuss over what time frame it intends to implement the new rates and how it will do so in a manner that's affordable to the state. The department should also discuss how it will balance phasing in the new payment system while continuing to expand the number of people served during the rollout. Exhibit 12 shows the most recent timeline for the rate setting process. At the time of submission, MDH indicated that they're continuing to work with advocates and the actuarial firm to finalize rates for 2023 and plan to be able to forecast general fund spending following the fiscal impact analysis completion. I'm just going to scroll so you can see the bottom of the timeline since it was cut off. And we're asking MDH to comment on the status of the finalized rates as well as when the general fund forecast using these finalized rates will be available. In addition to the information that I previously discussed, MDH provided a description of the data that's available through the new LTSS system and outlined ways in which LTSS provides for the electronic exchange between DDA users in the platform. It's unclear if the providers can utilize this ability to exchange data currently or if these abilities are built but not yet distributed to the providers. We're asking MDH to comment on whether providers can utilize the data exchange features currently, and if not, when these features will be available for use. DLS also recommends the restriction of funds in the fiscal 23 budget pending submission of the continuing transition report on the LTSS system. We also recommend narrative requesting the submission of the monthly utilization data that MDH said they could provide on the 15th of each month. DLS recommends the release of the $1 million in general funds restricted from the fiscal 22 budget pending the submission of this report, and will process a letter to this effect if no objections are raised by the subcommittees. I want to briefly discuss two other updates. On page 12, you'll see Exhibit 13, which talks about Appendix K provisions. As you may know already, Appendix K for DDA's Medicaid waiver programs has allowed for both the flexibility of service requirements as well as financial support to providers during the pandemic. Effective January 21, 2021, Appendix K was extended to 6 months after the declared public emergency nationally, meaning that Appendix K provisions, as it stands right now, are extended to October 2022 without any additional extensions of the public health emergency. In addition, Chapter 70 and 71 of 2021, which were effective July 1st, 2021, allows for some modifications under Appendix K to extend indefinitely, and in particular, the provisions involving remote or virtual services. Appendix 13, as I said before, outlines these provisions, and at your leisure, you can read through them. They also include the date of termination. So the first half are the provisions that will be terminating at the end of the 6 months, and the second half of the chart will show you the Appendix K provisions that currently don't have a timeline for termination or have been extended indefinitely. And on page 25, starting at the bottom, you'll see a little discussion of the federal disallowance. I won't read all of it, but just to provide a quick background, in January 2015, in June 2015, the Office of the Inspector General, HHS, released a report that detailed overbilling of federal funds totaling $34.2 million for residential habilitation add-on services from DDA. The report recommended the state refund this money to the federal government, but MDH did not concur with the recommendations. And after MDH received a formal disallowance letter from HHS in June of 2018 requesting the refund, MDH issued a request for reconsideration. And as of the Office of Legislative Audit's statewide review of budget closeout transactions for fiscal year 21, there has not been an update on correspondence or action regarding the Office of Inspector General's final determination of MDH's request for reconsideration appeal process. I'm going to hop backwards to page 22. Page 22 outlines the budget recommended actions. I'm just going to walk through them briefly. Action 1 recommends the restricting of $1 million pending the submission of reports each quarter to the budget committees regarding the ongoing transition to the fee-for-service reimbursement system. This recommendation is slightly altered from last year's recommendation, but uses much of the same language to provide a more specific request for data. As each report is provided, $250,000 may be available to be released. So we're going to break it into quarters, and as each quarterly report comes in, we will consider releasing the funds. Action 2, pardon my scrolling. Action 2 is language, again, from last year. It highlights that there were reported increasing net general transfers out of DDA, specifically from the Community Services Program, to cover shortfalls elsewhere in the department, and this prevents that movement of money. This annual language is to address this problem, and it is the same language from last year's analysis. And finally, the third action that you'll see here at the bottom of the page, this is again in response to the fiscal 22 budget bill language for that utilization report. And it simply requests that the Maryland Department of Health provide the data that they indicated they could provide on the 15th of each month, and it provides a specific start date at the beginning of the fiscal year to begin being provided that data. Again, this is based on the budget bill language from last year. And with that, I conclude my presentation, and I'm happy to take any questions anyone may have.
Thank you very much for your presentation. Are there any questions from the subcommittee? Okay, seeing none, we thank you. We'll turn our attention to the secretary and whoever you would like to bring up. Secretary Schrader, good afternoon again.
Good afternoon, Madam Chair, members of the committee. For the record, my name is Dennis Schrader, Maryland Department of Health Secretary. I'm joined by Assistant Secretary Yee, who will give the responses to the analyst questions. I do send regrets from Deputy Secretary Bernie Simons, who had a family medical emergency and regrets not being here today. I'm also joined by our CFO, Emily Brandenburg, Rhonda Workman, our Policy Director from DDA, Robert White, Operations Director, and Nick Napolitano, who will all be available for questions. I did want to thank the analyst for her concise report, very insightful. And before I turn it over to Mr. Yee, I did want to mention one thing. We are appreciative of the leadership of Delegate Lewis Young, who gave us the opportunity to participate in the self-directed services work group. We have the shared goal of promoting self-direction, and it's a service that represents our values of empowerment, choice, and control. And one of the recommendations was for overnight supports. We're finalizing our analysis of that recommendation. We're hoping to have something to report out tomorrow on a regular scheduled webinar. But I did want to make that point before I turn it over to Mr. Yee. So, Mr. Yee.
Thank you, Mr. Secretary. Good afternoon, Madam Chair, members of the subcommittee, Webster Yee, Maryland Department of Health. We have provided our responses in detail in our written response to the subcommittee. I will just briefly summarize our responses. To the first DOS recommendation about comments on steps to increase utilization of available slots, the department, broadly speaking, is using our colleagues at the Department of Aging's Maryland Access Point to help facilitate general efforts at getting people into long-term care services and supports and for assistance generally on that spot. So with the Maryland Access Point, which is an initiative by the Department of Aging, the 20 Maryland Access Point agencies serve as a single entry point / no wrong door to help Marylanders plan, identify, connect, and access both private and public resources for long-term services and supports. And so we would recommend to the members that if you have a constituent just asking, hey, how do I approach things, that the easiest way is to simply direct them to the Maryland Access Point, and then trained staff will be able to assist your constituents with finding out more information and developing a roadmap for next steps. And then with respect to specifics, the Maryland Department of Health and DDA operate reserved waiver capacity. And so in our written response, we specify the circumstances for those reserve slots. And in addition, we lay out that with the Community Pathways waiver, we have 775 reserve slots annually. The Community Supports waiver, we have 478 reserve slots. And then the Family Supports waiver, we have 28 slots. And it goes into further detail about the approximate cost and the number approved and the most recent filled information. To the second request for comment on the current status of the wait list, the most recent waiting list and registry count as of mid-February is 7 slots for crisis resolution, 176 for crisis prevention, and a little bit more than 3,500 for the current request number. In addition, in our written response, we have a table with the total number of individuals taken off the waiting list in fiscal years 20, 21, and 22. To the next recommendation about the Department of Health's comment on progress in reducing the waiting list equity fund, the department does have statutory language drafted that will help achieve this goal, and we're, as always, willing to engage in a dialogue with any interested legislator or stakeholder about this language. To the question about why the additional federal funds from the first 3 quarters have not been added to the budget, we are currently finalizing and working on our second quarter projections and developing a federal fund deficiency estimate. As appropriate, we will have further discussions with partner state agencies. To the question about planned expenditures by fiscal year for rate increases and other enhancements, as outlined by the DOS analyst, the department has used 75% of the reinvestment monies from ARPA on a broad spectrum 5.5% rate increase. I should note that between that and the 4% minimum wage increase, that's a 9% rate increase. The rate increase was retroactive to April 1, 2021. As previously discussed with the committee in a couple of our previous budget hearings, we intend to use the ARPA funds as long as they're available, which is currently estimated to go through early calendar year 2024. And at that point, we'll have further discussions with the appropriate agencies. I should note that as of late Monday afternoon, we were informed by the United States Centers for Medicare and Medicaid Services, CMS, that the $60 million of provider grants, those grant funds are not eligible for a federal match. And so that will change both the DOS and the MDH estimates slightly, and we're working on determining that impact. And of course, our latest ARPA proposal for spending plans can be found on our website. It's posted publicly, and we're required to update it every 3 months with the federal government. To the question about vaccination rates, we've provided that information in detail, and as Ms. Smith alluded to in her analysis, we are pleased to say that about 80% of the individuals known to be receiving DD services, that they are vaccinated, and that about just shy of 5,200 participants have received their booster shots. As part of our overall vaccination strategy, we've been very engaged with the DD stakeholders to try to get vaccine out to individuals and Marylanders. We've also tried to do our best to make available the opportunity to get and request a vaccination clinic for any provider who's interested in getting their staff vaccinated. We've also required by order that all providers and operators of group homes have to offer their residents the opportunity to receive an additional dose or vaccine booster shot as appropriate. In addition, and lastly, of course, we encourage all Marylanders to get their booster shot so that they can participate in the VaxCash 2.0 vaccine lottery promotion. It goes through early May. Every week from now until then, there's a $50,000 drawing. We've had great geographic distribution in the winners, and we strongly encourage all Marylanders to get boosted. To the next question about the 2023 allowance does not provide funds to begin implementation of the LTSS transition. Our response is that the supplemental budget number 1 does provide $85 million in federal funds for the home and community-based rate increase and transition to LTSS Maryland DDA module. In addition, we've been working with the members of the Developmental Disabilities Coalition since midsummer last year, and we've had over 27 meetings to date. Some of those meetings have gone, well past 2 hours, where we've worked with the stakeholders on this transition, and in addition, the general question of rate setting. In our written response, we've laid out a general timeline where we're currently in phase 1/Group A. It's a continuation of the previous 6-month expanded voluntary pilot program for providers. And the next phase would be a secondary pilot for additional voluntary interested providers beginning towards July 1st of this year. And then we would go on to phases 3 and 4 and bring on folks as we fine-tune the process. To the question of the status of the finalized rates, we're currently working with the providers using a fiscal impact analysis tool to determine the impact of the new rates on their revenue. Once they've completed this tool, we'll work with them and Hilltop to validate this information. And it's important to note that as we move more into rate setting, that this is a process more akin to what this subcommittee is familiar with the managed care side of things, where you have an actuarial range of rates, and then you have discussions there. And generally speaking, and I'll let my colleagues talk in more detail, Maryland tries to navigate a balance between what is acceptable on the rate setting side. Let's see, and then, of course, we will fine-tune our general funds forecast as those rates are determined and revisited. To the next question about whether providers can utilize the data exchange features, our responses to that recommendation is we do not agree with the recommendation. We do have regular meetings, and we intend to continue to have regular meetings with stakeholders in the DD provider community, and we're happy to work with DOS and request for information. And so with that, I'll turn it back over to Secretary Schrader for questions.
Madam Chair, that concludes our presentation. We'll have questions, and I can bring up the appropriate people if we can't answer them.
Thank you. I don't see questions from the subcommittee, so I'll go first and then look back around after I'm done. And thank you for your presentation and your written responses to Ms. Smith's questions. In the analysis on page 6, she talked about the unused slots. And I read in your testimony on page 2, your responses, you talked about sort of the reserved slots for people based on specialized programs or needs. Can you just kind of tell me how that works, and at what point do you realize, hey, we don't need the number that we thought we did for court involvement, let's put those back into circulation? How does that work?
Sure, absolutely. Hi, my name is Rhonda Workman. I'm with the Developmental Disabilities Administration. I'm the Director of Federal Programs Integrity. And so what the waiver programs do, what the federal government allows you to do, is set aside slots or spaces in the programs for people or specific priorities and populations, such as transitioning youth, the court-related that you've talked about. And so what we do with renewals of our programs or amendments of our programs, we revisit those numbers to see if we need to make some adjustments to those. But that provides the opportunity for people to, in a sense, come into the program quicker than what would be typically on our waiting list. On our waiting list, we do support people that are crisis resolution first, crisis prevention, and then current request. And so anybody that's determined crisis resolution, we automatically offer them that opportunity to come in onto the wave, in addition to these reserved spaces that are noted in the federally approved application.
Thank you. No, I mean, I do see, obviously, each of the things on the list. It's very clear why you would have space reserved for them. I guess I just wondered if there are people who are in great need, and these opportunities to receive services on hold, is there a point where we go? And so I guess I just want to get a sense of how often you revisit and adjust those, so that we're not holding space that isn't utilized and then having unmet need on the other side.
Sure. If I could just add one additional clarification. In one of the reserved categories, it's called emergencies. And emergencies are for people that are unknown to the DDA. So this could be someone that, has been supported by a caregiver, all their life, and then something happens. They may have never reached out to the DDA. And when we come into situations like that, then we have those reserved spaces to get them right into the eligibility and application process. In addition to those other categories, such as the transitioning youth or people aging out of the foster care situation. So anybody in emergency, we would be assisting them, and anybody that's in our crisis resolution, homeless, abuse, neglect, exploitation, those people are immediately assisted to move forward.
Okay, thank you for that. Are there any questions from the subcommittee? Okay, looks like you are done. Thank you very much. Thank you, Mr. Secretary, and your team. We do have, members, a significant amount of written testimony on our desk, and we have witnesses signed up to testify on this budget. So we will start with Sequoia Tasker, followed by Laura Howell. Good afternoon.
Good afternoon. Good afternoon. My name for the record is Sequoia Tasker. and I'm the Executive Director for Lieutenant Joseph P. Kennedy Institute of Catholic Charities. We are a human service agency providing meaningful day services, in-home and community-based services and supports to children and adults with intellectual and developmental disabilities. Currently, we support about 300-plus people that range from 6 weeks to their late 80s. The supports and services we provide are vital to their everyday lives. Our direct support professionals, better known as DSPs, assist in all aspects of their day-to-day routines. Our DSPs are quite often the most important people in their lives and sometimes the only person. Currently, Kennedy, like other providers receiving funds from the Developmental Disabilities Administration, is experiencing an unprecedented staff shortage. Our current vacancy rate is 36%, and we continue to have challenges filling these vacancies. This work is complex and requires state certifications to complete certain tasks, yet the pay is of a minimum wage worker. It is incredibly difficult to keep staff within our agency when they can go to Target and make $24 an hour. Recently, we received a 4% increase, which is appreciated. However, due to the continued increased cost of doing business, it is not enough. While the disability community has been in crisis before, this situation is different. It is different in that there continues to be a staggering gap between what we are reimbursed and what our cost of doing business is. As we continue to move forward without adequate funding, we will continue to lose staff, and this will result in providers either potentially being smaller or not taking on any new program participants. Governor Hogan has the power to support a supplemental budget of $35 million in general funds for DD supports. This additional funding can support providers like myself in ensuring that our DSPs are paid a living wage and ensure that people we are supporting and youth that are coming into the system, leaving the school system, will have the supports and services they need to become productive Maryland citizens. On behalf of Lieutenant Joseph P. Kennedy Institute of Catholic Charities and the many other provider agencies throughout the state of Maryland, and most importantly, the people with developmental disabilities receiving supports and services, we ask that in addition to supporting the DDA budget, you do whatever you can to support an additional $35 million in general funds for DD supports in a supplemental budget. I ask that all committee members remember that people with developmental disabilities in Maryland are a priority. Thank you.
Good afternoon, Madam Chair, members of the committee. I'm Laura Howarth-Max, the Maryland Association of Community Services. We are a nonprofit association of 120 community providers who provide over 80% of the services funded by DDA. I want to thank this committee for your long-time support for people with developmental disabilities. We're here today in support of the governor's budget. And on behalf of the DD Coalition, I want to express our deep appreciation to Secretary Schrader for his extensive commitment to the DD community and the issues we currently face. You heard about all of our meetings, and it's really been gratifying to have that kind of partnership with the department. I am incredibly proud to represent community providers because they have done in the last 2 years what no one thought was possible. But I unfortunately am here to say that where we are right now is not pretty. Our workforce crisis is nothing short of disastrous. Our most recent data from January shows that 1 in 3 providers are reporting a vacancy rate between 30 and 60%, and most alarming, almost 1 in 10 have vacancy rates between 50 and 60%. And that is of their direct support professionals, their hands-on staff. We cannot continue like this. Secretary Schrader and his team have worked very hard to get the federal ARPA funds out to DD providers as soon as they could, and that resulted in a 5.5% rate increase on top of the 4% that you all approved last year. And we're devastated to say it hasn't put a dent in our workforce problems. Without a solution, we are not going to be able to continue to meet people's needs. And to be blunt, as you heard about the wage increases at Target and other big box stores, staff who are providing care and support for people with developmental disabilities absolutely should make more than people stocking shelves. The 4% rate increase in the minimum wage bill from 2019 did not keep pace with the minimum wage, and we knew that when it passed. It was what we could make happen, but we knew it would be a struggle. But that bill assumed a 2% increase in inflation annually, and we're now looking at 6 to 7% in inflation. As you heard from my colleague, we are urging the governor to put $35 million in general funds in a supplemental budget and to speed up the department's plan to increase rates. The great thing is there is a plan in place. We just need the funds to make it happen. So we hope that in addition to supporting the budget, you'll do anything you can to support that effort as well. The last thing I want to note is the revenue increases that were referenced for the pilot providers in the analysis was based on proposed rates that have since changed, and we do continue to maintain some significant concern about rates for the day services that people are so dependent on, because based on initial analysis, it looks like a lot of providers are going to lose funding with those rates. So we're working with the department, but I wanted to bring that to your attention. And that is it for me. Happy to take questions. And I don't know at what point you want to do this, but I think we're going to hear from Ken Capone with his video testimony from people on the go.
We are. Let me see if there are questions for this panel. First, Senator Rosapep.
Thank you. On this huge vacancy rate that you have, and I get the economics of it. What are the, I'm sure it varies, but what are the general credential in one category and training in the other category requirements for the people you hire in the big job vacancy areas?
So DDA has training requirements. On the training side, DDA has training requirements that providers need, that staff need to meet. And then if those staff also pass medication, it can be an aspirin, it can be prescription sunscreen, it can be anything like that. And that's the majority of our staff. They have to be certified as medication technicians under the Board of Nursing. That's a whole nother layer. And then the department will be implementing accreditation requirements, particularly starting with staff who provide employment supports to people with developmental disabilities. So it's a lot.
So the ones who deal with medication, you used words that I knew what the words meant, but I didn't get. These are medical what technicians? It's
called a CMT, a Certified Medication Technician. It falls under the Board of Nursing, and they fall under an RN. So an RN, registered nurse, will delegate authority to.
Okay, so they're below an RN.
Oh yeah.
And so what is the length of time training to get certified?
I'm gonna pass that one to you.
So for my agency, we have a week-long training, an intense training that they're working one-to-one with the nurse. Then there's ongoing trainings that occur because as some of us in the room who take medication, our medication dosage may change.
Sure.
So we're constantly having to update them on any types of side effects and so forth. We have quizzes that we do at our agency in reference to those updates, but there is also an exam that they are required to take and pass at 80% or higher that is administered by that registered nurse. Now, earlier you had made a comment saying they're lower. This is the DSPs that I spoke about earlier, the direct support professionals. There's nobody kind of in between that is doing that type of work. So these are the people who are receiving the minimum wage.
And that is one of your biggest vacancy areas.
Yes, sir.
But it sounds to me like there are no credential requirements before you come to work. You come to work and you get trained, and then you take the exam or take the test or whatever it is. Is that the way it works?
No, when we hire people, we do look for people who have experience. Now, some of that experience may not be clinical experience. It may be they've worked with a relative that had needs.
No, I'm sure you look for experience, but there are no artificial barriers to this. I mean, if somebody walks in and seems like they have their act together, you can train them and they can take the test and they can work. Is that a fair description?
As long as they pass our credentialing. They do go through a background check, a federal background check.
Oh, okay, a background check to see if they're, bad people.
Yes.
Gotcha. That was question number one, Madam Chair. I'm going to have one more question, if I may. How do you recruit people for these jobs?
Various ways with different websites, different events, which of course, right now in this environment, most of those events have been virtual. We partner with a lot of colleges. I know for us, we partner closely, as we're part of Catholic Charities, with Catholic University to try to get like social workers or people interested in human services, but it truly is a challenge because they're typically offered a better paying job.
But that implies you're talking about college graduates or college students. I thought you didn't have those requirements.
Well, these are people who we partner with to try to get any type of staff that would be potentially eligible or interested in the field.
Did you want
Can
to
I just jump in for a second? So the majority of this direct support professionals are not college graduates. Some agencies are able to do some work in recruiting, particularly if people are in training, we'll see that. But the reality is, college degrees for direct support professionals, that used to be something that was common 30 years ago that we just don't see anymore
Sure.
because we're at minimum wage or just
Sure, no,
above.
I understand. Okay, thank you, Madam Chair.
Thank you, Senator. Any other questions from the subcommittee? Let me just say, I wanted to acknowledge, thank you both for your testimony. I wanted to acknowledge the secretary and his team talked about the number of meetings that they've engaged in with the community, and I wanted to acknowledge both sides because that is a huge time commitment to work through some of these challenges. So I applaud both you and the department for giving your time and focus to these issues. I know that we have on this panel Kenneth Capone, who I think you were mentioning, and if we're ready, we can pull up that testimony.
Hello, committee members. My name is Ken Capone. I am the director of People on the Go with Maryland, which is Maryland's statewide self-advocacy organization. People on the Go Maryland builds community through diversity and inclusion. We respect the individuality of our members and are committed to making inclusion a priority so that everyone feels comfortable, valued, and heard. People on the Go remains distinct by maintaining a cross-disability strategy that focuses on effecting positive change in the lives of people with and without disabilities. We are here in support of the Developmental Disabilities Administration budget. There are over 200 organizations in Maryland that provide services for 18,000 Marylanders and their families. These services are so important for people with disabilities. Most of the people with disabilities couldn't live a life of their choosing if these services weren't available. It took me years to receive services, and when I did receive services, my life changed for the better, so we are here today advocating for more funding for community supports. Underfunding of support services is the real disability. We need to be able to live real lives of our choosing in our communities with appropriate supports. State resources will need to be dedicated to support the following, but not limited to, rebuilding of provider agency programs, establishing new agencies, staff recruitment and retention, and well-being support efforts. The pandemic has proven the value of direct support professionals and the impact they have. People on the Go Maryland encourages legislators to respond to the workforce crisis of the developmental disabilities provider community and do everything you can to support the supplemental budget to increase funding for supports, and most importantly, direct support professionals. We would like to thank the Developmental Disabilities Administration and Secretary Schroeder for their continuing support of people with developmental disabilities. Thank you.
Thank you, and while that testimony was pre-recorded, we appreciate Mr. Capone's time and also the wonderful nature sounds in the background. So he sounds like he hit on the salient points that you all did in your testimony. Are there any questions for this panel? Okay, thank you all very much.
Thank you.
We will turn to Megan Ruciano, hope that was close, and James Stockton. Good afternoon.
Good afternoon, Madam Chair, and honorable members of the subcommittee. My name is Megan Ruciano. I'm a managing attorney with Disability Rights Maryland, formerly Maryland Disability Law Center. We are here in support of the governor's budget for the Developmental Disabilities Administration. This year's budget contains critical funding for transitioning youth and for over 300 people on the wait list for services. For these folks, DDA services are a critical lifeline that can enable them to live and flourish in the community. This year's budget also provides a critical rate increase for DDA service providers, and it comes, as we've heard, amidst an unparalleled workforce shortage. Direct support staff have been on the front lines during the pandemic, literally putting their lives at risk to provide support to people with intellectual and developmental disabilities so that they can continue to live in the community. Without them, we at Disability Rights Maryland have seen firsthand how people with disabilities face institutionalization, criminal justice involvement, and long stays in emergency rooms. The importance of direct support staff cannot be overstated. As a part of the DD Coalition, DRM is especially grateful to the Department of Health and the Department of Disabilities under the leadership of Secretary Schrader and Secretary Beatty respectively, who have worked tirelessly with our coalition to develop a plan to modernize and increase rates for direct support staff. We applaud this commitment and the rate increase, but additional funding is needed to now address this unprecedented workforce shortage. The rate increase needs to be fully funded now, and people with disabilities' lives may depend on it. The budget falls short in failing to fund the nearly 3,600 people on the wait list for services. I can tell you that for these people, accessing services, as Ken mentioned, can completely change the course of their lives and embolden their success. While we wholly support DDA's budget, we also highlighted in our written testimony, and I'll highlight here, 3 trends in DDA services that need attention and leadership. The first is the need to fund residential services for children with IDD, who without these services are often forced into the foster care system. Second is the need to fix the definition of personal supports to ensure that people can receive overnight supports. And third is the need to address the fact that skilled nursing services have been excluded from DDA waivers, forcing many young people into nursing facilities when they should have access to these services in the community. We will continue to work with DDA to address these critical issues. We urge you to support and shape the DDA's budget and system so that people with IDD are fully integrated into the community. Thank you for your time.
Good afternoon, Madam Chair Griffin and members of the committee. My name is Jim Stockton, and I'm here today speaking on behalf of the ARC Maryland, whose relentless advocacy has greatly benefited the disability community of Maryland, which includes my daughter. The ARC Maryland is the largest statewide advocacy organization dedicated to the rights and quality of life of people with intellectual and developmental disabilities, and it supports the budget for the Developmental Disabilities Administration for Community Services and Supports. We appreciate, and I in particular, the support we have received from Governor Hogan, Secretary Schrader, and other members of the Department of Health team for continuing its ongoing dialogue with the DD Coalition around key issues affecting Marylanders with intellectual and/or developmental disabilities. The Developmental Disabilities Administration budget funds services and supports to approximately 18,000 Marylanders and their families. Without these needed supports, many Marylanders with intellectual and developmental disabilities would not be able to pursue and obtain employment, remain in their homes with their families or in their own homes, and would not be able to perform many of the necessary activities of daily living that many with disabilities take for granted. Community support services are often provided by essential healthcare workers known in the industry as direct service providers, direct support professionals. These supports include, but are not limited to, job development, job coaching, and workplace assistance, day-to-day personal care tasks such as bathing, feeding, dressing, medication administration, and everything in between. The COVID pandemic ravaged our system of community supports with large numbers of direct support professionals exiting the jobs for less risky jobs with better pay and benefits. Needless to say, as a parent, this disruption in staff retention has really been a major problem, and it has caused undue stress in families. And I am one who has experienced that. Providers and people with disabilities with self-direct their services have focused a great deal of effort on recruiting to fill vacancies and on retaining the DSPs who remain. Unfortunately, Competition for workers from the food and beverage, retail, and other industries has made pandemic recovery next to impossible. And when one adds the impacts of inflation and the most recent wave of COVID, it is safe to say that we are at a historic low in our workforce numbers and are truly in crisis. While we are deeply appreciative of the 4% funding increase for DD Community Services that is included in the governor's draft budget and other needed funding included in the budget to support people in crisis, transitioning youth, people aging out of children's services, short-term supports for families, and supports for individuals with the oldest caregivers on the waiting list. This said, we know we need additional funding to attract and retain a qualified workforce to meet the needs of Marylanders with developmental disabilities. Along with traditional DDA community service providers, there is a growing constituency of individuals who self-direct their services and supports. These individuals with disabilities are employers of record and are responsible for training, retaining, and recruiting their support staff. Just as service providers are struggling to retain and recruit staff, so are people in self-direction, oftentimes with little to no backup and staff available if an employee calls out from work. In 2014, the Maryland General Assembly ordered a rate study to examine the rates for developmental disabilities community services. That study was recently completed and shows that adequate funding for DDA would require a significant increase to the DDA budget. The state has communicated a plan to phase in increases over a multiple year period. We are grateful for the forethought and also respectfully ask that the timeline for the rate phase be escalated in light of our workforce crisis and other historic changes to the cost of providing services. During Developmental Disabilities Day at the legislature of 2022, the advocates met around a theme of community for all. In order to make that a reality, we must have adequate funding levels for all current Marylanders being served and for those who will need services in the future. This is essential if we want more people with disabilities participating in the economy, buying homes, having relationships, or doing whatever their peers without disabilities do. To that end, we ask you to fully fund the Developmental Disabilities Administration budget, and we ask for your support for a funding supplement, should that be possible. Thank you for your time.
Thank you so much for your testimony. Are there any questions from the subcommittee members? Okay, seeing none, thank you both for your testimony and advocacy. Thank you, Mr. Secretary, and all of the witnesses and all of you who hung out with us this afternoon. And thank you, Ms. Smith, for your analysis. Subcommittee, this meeting is adjourned.